everyone. This is a bottle of doxycycline, which is often used in America to treat acne or other skin irritations. It's used in Africa, though, to prevent malaria, which is a life-threatening disease. And tonight, throughout the course of my conversation, I hope to explain to you the use of medicine like this one in medical missions and how it can be a platform for advancing the gospel and alleviating suffering. I've had the opportunity to serve over in South Sudan for the past couple of years on clinics, and I've been able to see firsthand how medical missions can combat the physical and spiritual needs that people have and ultimately alleviate suffering. And I believe that medical missions is a wonderful way to meet those physical needs while also promoting the things that God values, such as compassion and mercy. And I hope to show how medical missions can be a platform by educating you all of the needs in Africa, and also by educating about the role of medical missions to meet that need and how they fit together through personal testimony that I'll give. So I believe that there is a desperate need for both humanitarian and medical aid in Africa. It was Bono who said in the foreword of Sachs's book, The End of Poverty, 15,000 Africans are dying each day of preventable, treatable diseases such as malaria, AIDS, and tuberculosis for lack of drugs that we take for granted. And according to C. Gordon Olson in his book, What in the World is God Doing? In South Central Africa, over 23 million adults are infected with HIV, and over 14 million children have been orphaned. I have personally seen this in Lobotok, South Sudan, which is a very remote village in the low peat mountains of eastern equatorial state, South Sudan. There is very poor hygiene there. There's lack of medical resources and medicines, little access to health care and clinics, hospitals. There's also many treatable and preventable diseases that run prevalent. I've seen malaria and tuberculosis, I've seen leprosy, burn contractures, many bullet wounds, and abscesses. All of these things treatable and preventable through medicine. So there is a need, and it's a great need, but how will it be met? I want to show you how this is the part where medical missions comes in and meets that need. So I believe medical missions is an excellent platform by which to share the love of Christ while meeting immediate physical needs of others. Medical missions meets these physical needs by providing medicine to combat diseases, to provide vaccines to prevent diseases, and then also educating communities about hygiene and sanitation. Richard Stearns, in his book, The Hole in Our Gospel, said that if we are to be a part of the coming kingdom, God expects our lives, our churches, and our faith communities to be characterized by these authentic signs of our own transformation. Compassion, mercy, justice, and love demonstrated tangibly. Keyword tangibly. Through medicine, I believe we're able to demonstrate these authentic signs of mercy, compassion, and love in a tangible way. Medical missions can also help to meet spiritual needs, I believe. Dr. Bruce Steffes, a surgeon and educator who has much experience with medical missions in Africa, says that the hospital and clinic can be a fertile ground for evangelism when the medical work is done as a work of compassion and a natural outflowing of Christ's love in us. In South Sudan, each morning before we would begin our clinics, we would have a devotion time and clearly present the gospel to those that we would be caring for that day, giving us a chance to explain what we're doing and providing physically for these people, yet also showing them the love of Christ and providing spiritually for their needs in the name of Christ. There are many opportunities with medical missions, whether it be surgical procedures, dental clinics, maternity wards, or even health and community hygiene awareness in rural villages. There's many organizations that are working around the globe to combat suffering and these diseases, and A few of the examples are Medical Teams International, World Medical Missions, which is in partnership with Samaritan's Purse, Doctors Without Borders work in many areas around the world. We've seen the need, and we've also seen the way that medical missions can be a channel to meet that need tonight. And I'd like to share with you how I've personally seen this in South Sudan through a little girl named Aromo. Aromo was up in the top of a tree picking leaves that they eat, and she fell, causing huge deep lacerations above and below her eye. I was able to assist in the suturing and subsequent bandage changes, dealing with that, and then later on remove the stitches for her. And all the while going to visit her in the village and being able to educate her on the medicine to prevent infection, praying with her. This opened up a way to provide for her spiritually as well as physically. So medical missions enhances the lives of those you care for, and it also promotes the things God values. Micah 6:8 implores us, "What does the Lord require of you, but to act justly and to love mercy?" So in conclusion, through the means of medicine and volunteers who go to serve, diseases are treated, knowledge is gained through educating communities, and hope is found through sharing the gospel of Christ. Just as one small pill, doxycycline, has a profound impact anatomically, so can the hands of one who goes to serve in medical missions have a huge impact globally. Thank you.